We're going to start in just a minute. Is that Mr. Belcourt for us, or is that Mr. Haycock?
That's Mr. Haycock. Mr. Belcourt will be here very shortly.
So I guess we don't have an AG here yet anyway. Is Sophia supposed to be here?
Dennis's computer's here, so I believe he will be staying here.
I cannot hear you. I'm sorry.
Mr. Belcourt will be here.
Okay, excellent. So we'll just wait. When he comes in, let me know, and then we'll start.
Will do. Thank you, Madam Chair. We are ready when you are, Madam Chair.
Thank you very much. Okay, we are going to start our Consumer Assistance Advisory Committee. This is Lynn Atkins, chair of this subcommittee. I'm calling this meeting to order. It has been properly noticed, and I'd like to welcome everybody to the continuing meetings of the Consumer Assistance Subcommittee. Is anyone smiling? I'm trying to get everyone down here to smile. So welcome. Mr. Fisher, if you could take the roll.
Thank you. Ms. Atkins.
Present.
Ms. Lewis. Ms. Ellis.
Here.
Ms. Joyner.
Here.
Thank you. Mr. Mazzoni. Here. Mr. McCoy. Ms. Parati Buthman. Did I pronounce that correct? Boothman. We have a quorum.
Thank you very much. Does anyone have any announcements? Doesn't sound like it. I guess I just want to say thank you to everyone again, and I want to thank staff at the beginning of this meeting. I think we've got Shauna, Damon, and CJ up there, and Steve here, and everyone's been working so hard to address the issues that we've brought up with the Consumer Assistance Committee meeting, and I really appreciate it because I know, as I've said before, and not that anyone doesn't know, but there's so many moving parts and so much work being done, and I just want to thank staff again for all of your hard work and time on these issues. So with that, we will go to public comment. Is there any public comment in the north?
It does not appear so, Madam Chair.
Is there any public comment in the south? Yes, we have Mr. Gold. Permanent public comment.
Good afternoon. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada. And I'm here today to talk about your ongoing discussions about the continuation of the navigators and assisters, also known as the exchange enrollment facilitators. And I urge this committee and the board, when you're discussing and making decisions about contracting with the enrollment facilitators, the navigators and assisters, to seriously consider what the method of payment is going to be and how you're going to contract with them, because it needs to be important that you consider their ability to provide impartial information and resources and guidance to people that they are talking to. They need to be able to give this information without thinking, I have to get them to sign on the dotted line or my agency will not get paid. So that's very important. They do so many other things, including outreach and a lot of other things that can't be identified in a per enrollee contract type of a situation. They shouldn't be penalized when you're looking at contracting with them for the performance that they had previously, because after talking to both brokers and agents and facilitators and assisters, it wasn't they could have signed up more people. They would have signed up a lot more people if the systems had been working correctly, whether that be the call center or the website. So I think it's important to just, and any kind of a fee for per enrollee is a difficult situation because the enrollment facilitators are not selling insurance. I remember in some of the early meetings of this, we talked about whether they were selling insurance or not. They do not sell insurance. The brokers and agents traditionally kind of sell insurance, and they get paid for selling insurance. Assisters and navigators do not sell insurance. They provide information and guidance, and their contracts, while I don't know all the details, were based on geography, on size, on outreach efforts, on tactics, on all kinds of things. And moving forward, whatever method the board and this committee and the staff decide to move forward should consider all those factors and make sure that they have that impartial ability to provide those resources. Thank you.
Thank you, Mr. Gold. Any other public comment down south? With that, I'm going to close public comment, and let's go to agenda item 3. And if I can just get on the record, I think everyone in the committee knows Ms. Ellis works for CARE, which is one of the Navigator agencies, and she is a enrollment assister. She will be participating in the discussion as part of the committee, but will be abstaining from any vote.
Board reports, and the committee's all very familiar with the duties of navigators, and it's been discussed what their duties would be during open enrollment and in between open enrollments as well. So moving to the second portion of the report is assessment of the EEF program. There are 2 tables based in there looking at planned enrollment versus actual enrollment is the first table. We can see that there's a net delta of 51,000 individuals that weren't enrolled. That could be due to errors in the website not working on time, and those things that were discussed earlier in the board meeting. The second table goes over the total award versus planned enrollment for all entities and lays out a cost per enrollment. That cost per enrollment varies anywhere between $29.87 all the way up to about $56.91 depending on the entity. It's important to note that all of these dollars included the purchase of material to start the grant and the purchase of possibly computers and other office equipment, phones, phone time that may not be necessary in restarting those grants. Looking at page 4, we move on to the results of the EEF program to date, and we can see the actual cost per enrollment there in the far right column. Going down, we have numbers ranging from $87.52 all the way up to $1,079.65, looking at the actual enrollment figures through January. Lastly, the EEF staffing levels of what each individual company or each individual entity had proposed and where they are at currently are listed, and we're looking at the current amount of full-time equivalents at 61 for the entire program going forward. This information is provided in conjunction with letters and reports from grantees that responded to the request of the board that are behind. We have CARE, Ramirez Group, East Valley Family Services, and Nevada Primary Care Association that are behind looking at what they are looking forward into the open enrollment period, between open enrollment periods and into the next, what they would need for their staffing. All this information is provided to the committee for review of performance, and with the goal of the committee being able to select individuals moving forward if they want to continue the contract with every grantee that we have listed, or if they would like to weed out or select the highest performing entities in that. With that, I will rest and answer any questions that you may have.
Thank you, CJ. Are there any questions of the board at this time? I have a question then. So Great Basin, was it just a name change, or is it a new entity?
Yeah. So Great Basin Primary Care, sorry, this is Damon Haycock for the record. Great Basin Primary Care Association has been renamed to Nevada Primary Care Association because they are now a statewide entity.
And, I mean, it looks to me, I'll just start the discussion. It looks to me like you guys gave feedback, 'cause we're hearing stuff down here.
They're working to correct it right now.
Sounds like a song. Or a dolphin. Well, it looks to me like there's 3 entities that seem to be better performing than the other entities, and it seems like the Ramirez Group, I'm just for purposes of discussion, I'm going to call it Great Basin Primary Care and CARE. Those seem to be like the 3 top performing Navigator entities that we have contracted with. Would everyone agree with that? Okay, so if we were to choose to just contract with these 3, enter into grant agreements with these 3, I guess we should step back for a moment, and for those of you that were not at the board meeting, the staff reported that we do have funding to continue with these grant programs, I believe said through December 31st, 2014. But that we would need to kind of look and see how many entities we wanted to fund and kind of work from there. Is that correct? Shauna, CJ, or?
Yeah, this is Damon Haycock for the record. That is correct.
Okay, so first of all, yay, yay, yay. Thank you.
Yes, that is correct. You're welcome.
See, I get to be punchier at this meeting. Okay, so, all right, so it sounds like we need to kind of, so if we were to contract with these 3, let's just cut to the chase. If we were to enter into grant agreements based on the same grant parameters that each of these agencies are currently on through December 31st, without making any modifications to theirs, to those 3 grantees, are we able to do that?
So, Ms. Atkins, yes, we can continue with the grants. They have submitted proposed budgets through December, or at least through October, and we can extend them out to December on some of the entities, and we have the funding to fulfill exactly as they requested.
Shauna?
Yeah, for the record, this is Shauna. What I would request is that staff have the ability that as we're writing these up, that we could work with the entities, because just it might necessitate some changes to that original documentation that we had, and it would be very, very helpful to staff to have that ability to make some of those minor changes without having to bring it back to the committee.
Yes, Shauna, and I think that's what you did last time. I think when you went and met with all of the Navigator entities and were negotiating the contracts, and there was, no micromanaging from the committee or the board on that. And I think that seems like the appropriate way to handle things as well. It would seem to me that that I would think this committee should make a recommendation to the board that we have staff enter into grant contracts with the top 3 performing Navigator entities, let the board vote on that next week, and then let you kind of do your thing. Does that sound right?
It does. That's exactly what you and the committee did last time, and we would very much appreciate being able to do that again.
Okay, Mr. Mazzoni has a question or a comment?
Question. What happens to the monies we've expended on infrastructure with the non-participating grantees, East Valley, Latin Chamber, and Intertribal Council, although we've not spent any money on Intertribal?
Yes, for the record, correct. We have not spent any money on Intertribal Council.
Anything from the other, the 2 that we expended money on but didn't get much out of, or very little out of?
So there's different ways that we can go forward with that. All of the grantees were aware that at the end of the grant period, no matter when that might be, that it was up to the exchange to decide whether or not they would have to turn back in any of that infrastructure. So we could go to them and say, thank you very much for your service. We appreciate it. You purchased 10 laptops. Please turn those laptops back into the exchange. What we could do then is either put those laptops back out to the 3 remaining as extra laptops, or so that as they're going through their enrollment fairs, they have that extra infrastructure. We've had a couple that got broken. Things happen to that. It would give us the extras and backups at that point. I think that as new people come on, or if we want to have a big enrollment fair, it's nice to have those extra laptops sitting around to be able to enroll people. But we do have that ability for any of that infrastructure to go collect that and bring it back to the exchange so that we could then redisperse it to the current grantees.
Then to get the ball rolling, Madam Chair, I move that we endorse, if that's the correct term, Ramirez Group, Nevada Primary Care. Is that right, sir? CJ?
That is correct.
And Care as the 3 facilitator organizations we will contract with the effort made by staff to recoup any and all equipment and materials that we can from East Valley, Latin Chamber, and Intertribal Council.
Is there a second?
Are you Madam Chair? You're Madam Chair of this committee. I'm sorry. So Damon definitely has a comment that would affect maybe this decision. So
Okay, I think we need to get a second before we can have discussion.
I'm sorry, I
but
thought you had it.
No. I definitely want to hear from Damon. Do we have a second or do we not?
Madam Chair, this is Amber. I'll second it, but I also have some questions. But Damon can go first.
Okay, thank you. We have a motion and a second, open for discussion. Damon?
So the concern that I want to bring to the committee isn't the discussion of selecting these 3 entities as your top performers, recommending to the board to move forward. And it isn't even paying for these entities to continue providing their good services through December. Please recognize that next week we're going to be discussing the member per month fees that'll be adopted in April. And those fees are predicated on basically the variable costs or the fixed cost, depending on how we spin it, for Navigator entities to continue in 2015. So not only does there need to be a decision on how these grants are going to move forward through December, but based on how you want these folks to be funded on per member per month fees that are directly related to our operational costs in 2015 will actually lead into the final number for the per member per month fees that we adopt in April. And so that's another discussion, and I don't know if that should have been a different agenda item or if it's something you want to discuss at this time. But I think the committee is only going to have one shot at discussing this before the meeting next Thursday, when the board will just agree or disagree on the per member per month fees, and then you won't have an opportunity to influence.
I understood everything you said, and I think I'm confused. I'm not sure what is it that you think we need, what additionally do you think we need to do that either isn't on the agenda or that needs to be on the because this committee again is trying not to get too into the weeds about the dollar amounts and making recommendations about dollar amounts.
So then what I would suggest, Ms. Atkins, is that you move forward with your motion after Ms. Joyner answers her comments, and I'll just bring the numbers to the next meeting and the next board meeting, and we'll, based on the negotiations that staff will have with each of these 3 entities prior to the next board meeting, and then you as a board member and then the other board members will be able to discuss the financial side of how this will continue in 2015.
Mr. Haycock, that sounds better to me. I like that idea. CJ, Shauna, does that sound right as well? I want to make sure that everyone's on the same page.
Yes,
Mr.
it does.
Fisher's nodding his head here, but I want to make sure up there.
Yes, I think we can get that negotiation done and bring final budgets back to Thursday's board meeting. And then as long as the board then can approve those budgets going forward, Damon would then have that rolled into his PM conversation for Thursday. So.
And is the PM conversation next Thursday, or is it the board meeting in April?
So the PM discussion is next Thursday to give the board an opportunity to discuss the methodology of how we do the math. There are some factors that the board can make decisions on, one being how we pay navigators moving forward, another being if we're going to request Xerox to continue to perform the individual billing function. And so there's even other factors, as if you want to designate additional dollars for advertising in the interim between open enrollment periods. So there's all these factors that can adjust the per member per month fee up or down. And therefore, I'm going to bring those to the board with the ability to make instant adjustments at the table so the board can see what that final PMPM will look like. And then we'll post it the next day for the adoption hearing on April 10th.
Thank you very much. That process makes sense to me. So thank you very much. Ms. Joyner?
And thank you, Madam Chair. I think I missed a step. When we're talking about narrowing it down to 3 entities, I think that's kind of a bit of an arbitrary number, not knowing how much money we have. Why not 2? Why not 4? So my immediate thought is, what communities are we leaving out by cutting off 2 of them? And so I guess one of my questions is, and maybe this is for staff, was there not a letter from the Latin Chamber of Commerce? Are they not interested in continuing? And that might be helpful to know. Because I am concerned that there are communities that may be just left hanging, and I don't know how much funds we have. Why 3 was the magic number?
For the record, Shauna DeRose. So I did send out the request after the last meeting for all of the grantees to send in a revised budget and a letter of what they would do over the period of the month between open enrollments. And I did not get anything back. I did not get a budget back from them. I can continue to reach out to them. I know that they've had some leadership changes there, and that might be affecting part of it, but I did not receive anything back.
And Ms. Joyner, I don't know if I'm the one that kind of arbitrarily picked through. To me, like there was a natural break of the entities that are listed on the spreadsheet, that it looked like there were 3 kind of top performers. And I would think, yeah, so that's the only reason why I kind of suggested 3. And
I have a question.
Mr. McCoy.
Discussing before. I heard that materials would be picked up. So any material that like attempts for application.
If you could get closer to the mic, Mr. McCoy, please.
Yeah, get so directional. The comment was made that materials would be picked up from these others. My concern would be, do we have some potential enrollees that are sitting in materials with some of these other grantees, and what is going to happen to that information? Are they, if they're not following up on it, who is?
So, Mr. McCoy, this is Damon Haycock for the record. There's a couple issues with not wiping those computers. First of all, it's personal identifiable information, and when an individual signs an authorization form with an exchange enrollment facilitator, they are signing it with that specific person and that entity to provide them their personal information. I would caution the committee to not keep that information on those computers and allow us to wipe them, so there is no potential liability for Privacy Act issues. Yeah, and as Mr. Roos said, we also have letters that everybody signs, that the consumers sign, that allows us to contact them. So we do have their information to move forward and continue with those leads in the interim. But again, it's common practice with computer equipment when you transfer it from one individual to another that you wipe all personal identifiable information to ensure liability.
Thank you. So I know Mr. Mazzoni has a question. So for basically, it would be East Valley Family Services and Latin Chamber. Any of the folks that had either signed up through them or were maybe, I guess, if either of those entities have any information, we would be able to get that information and send letters or communications saying that if they need assistance, they can contact any of the other agencies as far as assisting them with enrolling. Is that right?
That is correct, Ms. Atkins.
Mr. Mazzoni?
I'm not Dwight Mazzoni for the record. I understand your concern, Damon. What I'm wondering is, as I read the disclaimer and the authorization at the HealthLink website, it speaks of authorization on behalf of the HealthLink and the Silver State Exchange. So I'm a little confused by your statement that that belongs to whoever was handed that computer, I guess. Is that what you're saying? The PHI?
So, Mr. Mazzoni, and I apologize if I misspoke. Yes, you are correct about the specific agreement. We're just trying to enter the idea to the committee, and it is the committee's, ability to discuss it and pass a motion if they like. But I just wanted to bring it to your attention that traditionally when people have a computer assigned to them, a portable device, not always is there information on there that you want to transfer from one person to another.
I'm still confused because we're talking about a release that's signed by the potential insured to the exchange, to the HealthLink, not to me as an individual, although I validated it, if you will, because I'm the guy, it's on my computer that I have, or if I'm a navigator, I assume Tibby could address this. It's on
For the record, CJ Bowden, Mr. Mazzoni, and there's a lot, if you're giving a person or an entity a piece of hardware, a lot of times they're using that for personal use as well, not just at work. I know I am guilty of that as well with my iPad. When I do travel, I answer work emails, and I also do other personal things as well with that. So we could run into problems with that data, as well as we will have the ability to reach out and contact the individuals if they are signed up on the Navigator's form. They submit an enrollment form on a monthly basis, and we'll have the HICS ID of that individual, and we can use that HICS ID to go through the system and reach out and directly contact those individuals because we have their individual HICS IDs noted for each enrollee in each entity.
This is Stevie Ellis for the record. I guess I can answer the question and also the concern about this as a Navigator organization. When we enrolled any of the applicants, not only are we representing them on the portal where they signed an agreement with the Nevada Health Link through the portal, but we also provide them with a form that is a consent for facilitation of enrollment by an authorized representative. And all the enrollment assisters use this form, and I'm going to show it to the people here. Maybe the staff in the north can show it to the committee members up there later on, but the form is signed by the individual. It has the name of the enrollment facilitator, and then it is signed by all the members, by the individual seeking the plan, and it lists all their members in the family and also their Nevada Health Link number. So if I understand well, once these organizations that had not been selected turned in their capital equipment, and that capital equipment needs to be resetted so that no personal information is kept there, we still have access and authority to follow up with those either pending applications or existing enrollees, because we are only representing the exchange, and in that disclosing form, it says that anyone in the Nevada Health Link can contact them and discuss their cases as need may be. I hope that this clarifies and helps. Thanks.
Thank you. Any other discussion? Ms. Joyner, any other questions on the narrowing down of Navigator entities?
Thank you, Madam Chair. I guess I'm still stuck on knowing how much we have to narrow down. Like, is it a given fact that we don't have enough funds to continue all of the navigators? And I guess that would be helpful to know.
So for the record, Damon Haycock, the amount of funding would not necessarily be an issue. The return on investment might be, and that is up to this committee to make that determination. I would never speak for a member of the committee or the board, so I don't know if any member would feel that paying for an entity that wasn't performing would be unfair to the other entities that were, but that would be a discussion and decision made by this committee.
Ms. Joyner, I think the other part of the discussion, and again, for those of you that were not at the board meeting, the board did vote to define a triggering event for a special enrollment period, and the triggering event date is going to be March 31st, so there's going to be a 60-day special enrollment period for folks who have tried to enroll during open enrollment, but were unsuccessful in doing that. So we have 60 days of a smaller group of people than the open enrollment, and then after that we've got 120 days before the next open enrollment. So I think one of the concerns that this committee talked about last time is that, yes, we wanted to keep the program and we wanted to keep the navigator entities and the EEFs. I don't know, I'm having a problem with that, EEFs, but that we probably didn't need as many because it wasn't an open enrollment period. So I think that's where the initial thought was, well, if we don't need all of them, let's kind of look at where maybe a natural line is drawn for maybe more productive ones and less productive ones. I get though that we are now talking about November and December, which is open enrollment. And I mean, I think one of the things we could do is agree to this, move forward with this motion now, and then maybe as it gets closer to open enrollment, I'm just assuming if we need more folks that these particular entities would be able to hire more. So that's kind of where my mind is.
So Ms. Atkins, this is Damon Haycock for the record. In the plans that have been submitted from the 3 entities so far for the budgets, some of them actually did increase staff, and they showed that increase for that next open enrollment. I think Tibby can actually speak to that because she's one of the folks that specifically did that. But that is in these plans in at least 2 of the entities that have submitted their budgets.
Thank you, Mr. Haycock. Ms. Ellis?
So what CARE did when they submitted their proposal, we broke it down into sections. We broke it down for the interim enrollment period, which is April to November or October, I believe it was. And then we submitted also the budget for October to February for open enrollment. During the interim period, we had the same number of staff that we had currently, and for the next open enrollment, considering that we will be re-enrolling current people and enrolling new people, then we increase the staff. That was the criterion. We listed that summarized cover letter that we submitted with the staff. So that was an example of how we submitted our proposal. So I don't know if that kind of helps also in making this decision that, like Damon said, some organizations are foreseeing increasing staff as the next open enrollment period is along. Thank you.
Any other questions or comments? So we have a motion and a second to recommend to the board to direct staff to enter into grant contracts with the top 3 performing agencies, which from this list are the Ramirez Group, Great Basin Primary Care, and CARE. All those in favor say aye.
Aye.
Opposed? Ms. Ellis, for the record, has abstained due to the fact that her agency is a navigator entity, and with that, the motion passes. Thank you all on that. That is terrific. And Shauna, thank you for, I know, your anticipated work on getting all those contracts signed, and I know there's such a short timeline, so again, appreciate you reaching out to them and getting all of this turned around really quickly, and I think, especially in light of the board's vote a couple hours ago, I think this is really crucial that we have this. So thank you everyone for that.
You're welcome. As Tibby can tell you, I'm a pretty tough negotiator, so we'll get it done.
Thank you. Thank you. Okay. Agenda. I'm going to close agenda item 3 and go to agenda item 4. And this is discussion and possible action on the report by Xerox regarding enrollment process and call center activities related to customer service. I think Xerox is here to answer questions that we had posed last time. I think there might have been a little miscommunication at the last couple of meetings, and so I don't think the information was communicated to Xerox that they needed to give us a report. So in light of that, if Mr. Vitiello could come to the hot seat, and I think if you could give just a general summary of kind of how the call center is doing and how the processes, kind of a little bit of what you did earlier today, just to get the ball rolling, that'd be great, and then we'll open it up for questions.
Certainly. So actually, as I reported last week, part of, can you hear me? Sorry, I'm trying to get used to the microphone. As I had reported last week, with people that were in the various buckets who hadn't completed either an application or had not completed payment, we had identified different enrollment campaigns that we were working towards to try to outreach those consumers. We, as of last week, had completed 5 of those campaigns, and as a result of those 5 campaigns, it was approximately 100,000 members that were reached out either through email or through a phone call or through a special mailer. Of those, tying back, there were about 1,500 responses that were received from those individuals and resulted in helping them complete the enrollment process. About half of those, about 700, actually completed a payment through the process. Just to address, some of the concerns I think that we heard earlier today regarding access, to the system. We're continuing to monitor either through going and speaking with our agents. We have been getting feedback from some of the navigators, such as Ms. Ellis's group, as well as the brokers community. And in some cases, we're finding that some are not having as many issues as they were, and in other cases, we're still hearing that people are struggling to get through the process. When I get up and report the progress, it's not turning a blind eye to the issues that still exist. So we're continuing to see those issues, continue to hear them reported. We're taking those back, trying to figure out if, where they are systemic or if they're a specific client's issue, and trying to get them to resolution. And that's always a concern as we're going out and trying to attract more people in. We're continuing in our efforts to try to reach out to folks in the last 11 days. There are several outreach events that are coming up. We are prepared to send staff to those, and we've actually reached out to, I believe, the Ramirez Group to identify who, how many people they need. We've also put on-call tech staff, so when issues are coming up, they can't, and just to be clear, they're to try to resolve the issue, but unfortunately, they can't always just resolve it on the spot, so it's something that requires further research, and so we're continuing to try to improve that effort. I know it's of an importance as we are in the last 11 days. One other item I would like to report on, again, we're continuing to try to address the payment issue. We know that people who are trying to make a payment, either through the web or through the IVR, have continued to experience problems. We did put a fix into the IVR last week, which we believe resolved many of those issues. I will not say that it 100% by any means. As an alternative, besides somebody being able to send a payment in, through the mail to the lockbox, I'm also working internally to try to set up a process where our agents could actually take the payment over the phone, either an ACH debit to their checking account and also take a credit card. I wish I could tell you today I would have it in tomorrow, and that was my hope last week. The main thing that we're trying to get through is that there are security processes that need to be in place when you're collecting financial information. We're prepared to do it. We just need to work out those aspects to make sure that we're securing the information. So I have more meetings tomorrow. I'm trying to get it through. I'm hoping by next week we'll have it, at least that we can help the people during the open enrollment, and then certainly as we move into special enrollment, that will be part of the overall plan and process. Anything else that you would like an update on?
I have a couple of notes written down here, but I think we'll open it up. I think we'll open it up to questions from committee members. Ms. Joyner, do you have any questions right now, or you want us to start down here? We'll start down here. Ms. Ellis?
TB Ellis, for the record. I have a couple of questions as we are preparing to go into the special enrollment session and also the interim enrollment session, which starts in April and ends in November. What is going to be the process for enrolling qualifying life events individuals? I know what the process is to enroll individuals today, but is that going to be any different at the end of April 31st and on March 31st, I'm sorry, and coming April 1st, if Jane Doe goes in the system because she was not aware that the end of open enrollment was the day before, is she going to be able to enroll, or are you going to lock the system? And if she is a qualifying live event candidate, is it going to tell her you're not allowed to enroll unless you meet all these criteria? And is it going to allow Medicaid applicants to continue? I have a lot of questions about how the portal is going to function. You may not have the answers. I understand that I'll be asking a lot of persons, but I think it's important to lay those questions right now so that perhaps either the staff or the board can start addressing this, because a week and a half from now, we are going to be going into a system that may or may not be prepared for both qualifying events, in addition to SHOP, which are some of those volunteers, small or medium-sized businesses who may choose to enroll their employees starting April 1st. So how is this going to work, and is Xerox ready to provide these services to this section of the population starting April 1st?
Okay. Can you hear me now? I'll address, I'm going to start off with what is supposed to happen on 4/1. As far as when the open enrollment period ends, the system is designed to no longer allow new applicants to come in and reapply, period. Except for Medicaid, it's still open for individuals who would qualify for Medicaid. To get into the specifics of exactly how the system will operate, I'll need to bring in a technical person to help you with that. But you know, we understand that requirement, and we need to be able to still accept Medicaid applicants because it's a single point of entry, you know, application system. Regarding qualified life events, you know, as we've been reporting, those were some of the features that were not available on 10/1 when we went live, and it was, you know, an area where we had asked to defer or had to defer functionality and delivery of the functionality. We're in the process at the moment of implementing those, but all of them with a plan to have all the qualified life events completely into production by the end of April. And from a scheduling standpoint, I'm thinking it's more like the 3rd to 4th week. It is dependent on once we complete the development, there's testing that needs to go on with the carriers. Right now, we're in the process of testing terminations as well as reinstatements with the carriers, so we can begin sending daily change files as opposed to the whole file replacements that we send today. And then the other qualifying life events that are more traditional that you would expect, they are coming in the April timeframe.
So when you, I just want to follow up with that. So when you say the April timeframe, so someone who has a baby on April 15th, I know they would have 60 days to do it, but they can't go in they won't be able to go in April 16th and pick a plan? Or?
Not on April 16th, by the end of April, yes. So.
Collective sigh down here.
Yes.
I don't know about up there. Okay, go ahead.
So in that situation, if that when that happens, and you know, when that happens, you know, those are issues that will need to be reported to us, and we will need to work with the consumer to help them get coverage through some other workaround process.
Will they be able to use the call center? So if someone has a baby on April 15th and wants to call and get coverage April 16th, will they be able to call the call center, and that they'll be able to?
The call center will remain open, and people will be able to call in.
And they will be able to apply and get insurance if they have a qualifying life event on April 16th.
We'll be able to assist them. again, we may not be able to help them on the spot. We'll be able to take their information and do a follow-up in order to resolve that person's problem. Once the system, that part of the system the development is completed, then they will be able to help.
Madam Chair, if I may.
Yeah, was that Shauna or?
Yes, it was.
Yes,
If I could just make a
go ahead.
comment. I just want to make a clarifying comment there. So the difference right now is that on August 16th, if a baby is born and a family wants to come in and purchase a brand new plan, they will be able to do that. The difference that Mr. Vitiello is saying that is not going to be ready until the end of the month is the ability to add that child to a current plan through that qualifying life event. So there are two different things going on there. And I just wanted to make sure that that was clear to you. That the difference between
It was not clear. Can you say that again? Because we would like to hear that again.
Okay, so the difference here is the difference between a new enrollment, a new plan selection for either the child or the family. A family or a child could come in, if they were born on the 15th, they could come in on the 15th or the 16th and start that plan, and they can do that. What Mr. Vitiello is saying that is not going to be available until the end of the month is the qualifying life event of a child being born on the 15th and adding that child to the current family plan. And we've been reporting to the board over the last couple of months the release schedule and the qualifying life events. This includes adoption, births, or even on the termination side, if a family member needs to be removed from a plan. These are the things that we're currently building. So again, anyone can come in and start a brand new plan, but I think what you all were talking about was adding a person to an already existing plan. And we have 60 days to do that from the time that child is born. And so if a child is born April 15th, by the end of April, the plan is to be able to add them back as of April 15th to that plan.
Except that Greg just said that they will shut down or block the ability for people to come and do no enrollment.
The fact that the baby was born is a qualifying life event for that person to come in and have a brand new plan. Just like if somebody moved to Nevada, they will be able to come in and they will be able to start a new plan, things like that.
Not until the end of April, though, according to Mr. Vitiello, right?
Vitiello.
So not until the end of April. So if a person loses their job at the beginning of April and they want to, it's a qualifying event, or they lose their COBRA, or they originally applied for Medicaid, but they were found not to be Medicaid eligible after all, and they need to be sent to QHPs, they won't be able to seek insurance until hopefully the end of April if you do all the testing and figuring out of the system?
So, Ms. Ellis, I think in order to get into now you're getting into the specifics as to will they be able to just start a new application? Because I know I just said to you that, for new people coming in, the system will not be available. What I'd like to really, so I want to restate the question to make sure I understand it, and then I'd like to, get back to you specifically from a technical standpoint of exactly what will happen. So, to be clear, I had indicated that new people coming in trying to hit the website on April 1, who won't be part of this special enrollment event, will not be able to go in and complete the whole process and apply. They'll be told that open enrollment begins, in the fall.
But they may have a qualifying event.
I understand. So I just want to restate.
Okay.
So I'm restating so I can make sure when I walk out,
Okay.
I can get you the information
Okay.
clearly.
So,
Separately, I did state that the features in the system that would allow you to change somebody's policy, their coverage, either by adding or removing, that all of that functionality won't be completely full. What Shauna is saying is that even though somebody has a qualifying life event and that even if they have to start a new application for that person, the system will still allow them to do that for that instance. But I can't tell you, just as you're asking me right now, how it will exactly work, which I can get you that information. So I just want to make sure that I understand that really you're trying to ensure based on both of my statements, that I'm not going to, in effect, we won't be able to add somebody to a plan.
I think that there's a confusion, so maybe I didn't explain myself well. Let me clarify. I am not speaking about a person who currently have coverage through the Nevada Health Link and their situation may change, like having a child that they need to add to their existing plan. I'm speaking about a person that may be insured by an employer who has nothing to do with the Nevada Health Link, and now as they lose coverage, and that becomes a qualifying life event because their hours are shortened or they were terminated for whatever reason, they need to go now into the Nevada Health Link and seek insurance through a qualifying life event, brand new application.
So honestly, Ms. Ellis, I'll have to get back to you on that specifically. That's how the system will deal with that, as well as from a policy standpoint. And
Mr. Mazzoni?
Let's back up for just a second. Somebody has a baby. Pick a day, any day, I don't care.
Talking to the microphone, Dwight.
Somebody has a baby. Pick a day that you have the baby. When will the system, either April, May, June, or next August, when will the system allow us to add that child to the coverage, and what would the effective date of that child on the coverage be? Number one. Second part of the question is, has either the exchange, CJ, Shauna, or have you talked to any of the carriers to find out how long they cover the baby before they require the child to be applied for coverage under their current system? Does that make sense to you?
yes, it makes sense to me. Again, I've not been in the details of the actual programming of how the system will function. What I will say to you is that the event to allow you to change an existing policy, add a child, that functionality to just change that policy and to do that will be available at the end of April.
For the record, CJ Bowden, when we look at statute when we look at statute and the special enrollment periods that are in place, if a child is born, the parents have 60 days from the date of the birth of the child to enroll that child in a qualified health plan through Nevada Health Link and pay for coverage. If they do so, coverage for a child goes retroactive back to day one of the child's birth. So that special enrollment is 60 days. If there's a child born on April 1st, they would have until approximately May 30th to get that child enrolled due to the special enrollment period. At any time in the year, they would have that 60 days.
Second part of the question.
Let me just follow up with CJ on that. So yes, that totally makes sense, CJ. So let me go back and ask about the person that has the baby February 15th. And their 60 days ends April 15th. How do they get?
For the record, CJ Bowden, if they are currently enrolled in a health plan, they got through and purchased a health plan on January 1st, coverage effective date. They have their child on February 1st. They will not be able to add the child to that. We are working with special groups. So I know we have special cases out on a manual process right now where we're working with the carrier and adding a person to the plan, but it's a manual process.
Okay, so I guess that's the question. So it's not something at the moment that you can't go through Nevada Health Link by yourself. Basically, you either have to go through the 800 number or go to a navigator entity?
You would actually have to go through Nevada Health Link. The navigator would have to go through Nevada Health Link as well and use technical assistance to make that happen, because technically what really happens is the original plan is canceled completely. A new plan is taken out for the family and adding the child. It's not adding the child, but the new plan is taken out for all members now. And we work with the carrier to keep the accumulated deductible and out-of-pocket maximums applied to the new plan. But it would have a new plan ID and new plan cards. That's currently what's happening. After April 30th, as Mr. Vidiello said, then the automated system will have the ability to add people to existing plans and delete people from existing plans. Right now, that functionality is not complete.
Second part, we have an open event. Somebody, for some reason, has the ability to come into the plan, and it's not open enrollment. Okay? So they come in to enroll on April the 15th, but they don't qualify for APTC or Medicaid. What are you going to do for them? You have described it very briefly. What are you going to do?
I'm not sure of the question.
You said
I
you
think
did not allow them to enroll at that point.
that's correct, because open enrollment is not open.
Open enrollment for APTC and for Medicaid is not open. Well, Medicaid's always open. Okay,
Medicaid's
so
always-
APTC is not open. Shauna, question for you. If I've got somebody that goes to HealthLink, signs up, they're not eligible for APTC, where do you want me to take them? Out to the open market, the heck with the exchange, or you want me to enroll them in a plan in the exchange? Without APTC.
I want to make sure that I'm understanding the question. So if somebody without a qualifying life event, somebody just missed open enrollment, they are not known to the exchange or to Nevada HealthLink, so they're not part of the special enrollment, you're saying that they show up in the middle of April, they go to put their information in, because you can put your information in. If you're eligible for Medicaid, you're going to be able to go through. If you're not eligible for Medicaid at that point, it stops the process and said you cannot sign up for a qualified health plan at this point because it is not open enrollment. So whether it is an APTC person or whether it is not an APTC person, it is not open enrollment at that point.
I didn't say it was open enrollment. I said somebody comes to the exchange, signs on, and we find out they don't qualify for Medicaid, and it's not open enrollment. They don't have a qualifying life event. I now have an option. As a producer, I have an option. I can leave them in the exchange and enroll them in a plan through the exchange without APTC, or without Medicaid, which gives you $4.95 per month, or I can go outside the exchange to the open market and enroll them. And don't worry about whether it's a 0-day wait or a 90-day wait. That's up to the insured. Where would you rather have me enroll them? In the exchange, on an open market plan without APTC, or you want me to take them outside the exchange and enroll them in an open market plan?
But Dwight, there's no option on that. I mean, it's open enrollment's closed.
It's not open. We're not doing an open enrollment. We're merely enrolling somebody in a health insurance plan.
Right, they would have to go off the exchange.
No, why?
For the record, CJ Bowden.
CJ, take it away.
The statutes state, when you look at exchange establishment regulation in CFR 45, the statutes state that if a person misses the open enrollment period, they are not allowed to enroll on a plan on the exchange. They are allowed to enroll in a plan off of the exchange without APTC. We would rather have them in the exchange, but CFR 45 does not allow us to enroll a person in the exchange when open enrollment is closed. They can go off the exchange and face a 90-day waiting period before benefits start.
So we really don't have a fourth door.
That is
How
correct.
many doors we do have, but yeah.
We have a Medicaid door, we have a Medicare door, and we have an APTC door. We don't have just a market door within the exchange.
We have a market door during open enrollment
No, we
and
don't.
qualifying life events.
No, we don't.
Yes, we do. Dwight, we do. The exchange is
qualified-
open during open enrollment or a qualifying life event. Those are the two times that you can get health insurance through the exchange, qualified health plans that are not Medicaid. Those are the two times, open enrollment or qualifying life event. Is that a correct statement, everyone?
Yes, that is correct.
So if
I
someone wants to
have
buy,
a qualifying event and I enroll, what are my options going through the exchange?
if you have a qualifying life event, you can go on the exchange at any time. You have 60 days from the date of that qualifying life event, the triggering event.
What product do I get?
Any product.
APTC?
Yes.
Okay, I'm not APC. I don't want APTC.
Then you get whatever else is on the exchange without APTC.
He just said I couldn't do that.
If you have a qualifying life event, you could do that.
Wait. Dwight, you have to have, if someone has a qualifying life event, they can go on the exchange and purchase a health plan at any time. At any time, whether they're APTC qualified or not. It is what CJ said. It is exactly what CJ said. What you're asking about John Doe, who has no qualifying life event, that is coming in July 1st, that person, if that person wants to get help, is not Medicaid and has no qualifying life event, that person has to go off the exchange. Is that correct, everyone? I'm seeing yeses.
Yes.
That's correct. That's how it is.
Then we really don't have a fourth door, per se, for people, right? We have 3 doors that are available through the exchange. Is that right, CJ?
We have open enrollment, qualifying life events, or Medicaid eligibility.
I have a qualifying life event, and I don't qualify for APTC. Where do I buy the product? Through the exchange?
If you have a qualifying life event and you do not qualify for APTC, you may purchase on the exchange.
Thank you. That's what I was trying to get at. That's very hard to get through some of this stuff. Jeez.
Well, now that we're all on the same page.
You do that too, you know.
I'm sure I do that. I'm sure I'm the queen of doing that.
I would like to suggest, if I might, between the exchange, and I don't know about Health Link people down here and whatever, and maybe the Agents Advisory Committee that this board or the board is doing, that some of this detail is written up so that we can distribute it, because there's a lot of people out there that don't even understand how to do an enrollment even with the exchange and with what's going on.
So I'm going to move on. What other questions do we have for Xerox? I have a couple more. Should I just start? So I think Ms. Joyner brought up at a couple weeks ago a comment about the Medicaid denials, and those folks were not able to go back and get into their system. It was locked. They couldn't use their username and password, and the system was locked. And what everyone thought would be an easier solution is for the Medicaid denials for people to get that notice that they've been denied. They can just go back and log in the system and kind of finish the process. Is there any discussion about getting that fixed or working with that? I just think that sounded like a very logical thing to have happen, so I'd like to know if there's what the status might be of that.
So with regard to that is supposed to be an easy process, and it is supposed to be that they can come in and do. We are meeting internally because we're expecting, with the number of Medicaid applications that have been routed over to DWSS, we are expecting to start receiving those back as they, or some of them, because there may be, once they get additional information, we're expecting that to come back in. Honestly, we're still working through that process. And if there's a board meeting next week, I'll come back with exactly how that process will work.
Madam Chair, if I may.
Please.
Just to give an update, one of the things that we are working on right now is kind of what we've been calling that Medicaid loop. Someone goes in, they apply, they fill out the information, and based on the information that they put into the system, the person is Medicaid eligible. It goes over to Welfare and Supportive Services. Welfare and Supportive Services says, you know what, you actually took some deductions that you probably shouldn't have. We are finding that people are taking deductions for things that are not MAGI eligible. People are taking deductions for business expenses. People are taking deductions for all sorts. We had one mileage the other day. Somebody had a mileage in there. When you put all these deductions back in, now you're over the cost limit for Medicaid. And so the person gets a denial letter, says, you know what, you actually make more money than you should for Medicaid when we put all this back in there. So then the person gets the denial letter, they come back to us, and the problem is that in many of these situations that the applicant doesn't understand really what they did that caused this problem. So if they come back to the exchange at that point and they go to fill out their application again, they put the exact same information in again. We say, oh, it appears you're eligible for Medicaid, and we send them back on their way. One of the things that we are doing right now is we are talking about tightening up those deductible areas so that we give people a better understanding of the types of deductions that they can take, so that they're not taking things where that the wealth services staff is just going to automatically have to kick them out and send them back over to us. Because obviously with Mike Golden testified that he had 59,000 applications sitting there in their queue, and if even 10,000 of those are people who took the wrong type of deductions and they should never have been sent over there in the first place, you know what? We need to fix that. So the team is currently working on the system. We are going to be tightening up the types of deductions that we can have out there, tightening up the examples that we provide people so that they know, you know what, don't take a deduction for a business expense or mileage or things like that. And I think that is one thing that will really, really help the denial letters. So right now, the other thing is the denial letters that people get for being non-responsive. If you put in your Medicaid application and Welfare and Supportive Services has to reach out to you and get more information, but they don't reach you. And they've tried, 5, 6, 7 times. I'm sure Mr. Fisher can tell you. And then they don't get a response from the person. They get a letter that says you are being denied for non-responsiveness. Now that person can come back into the exchange and they can get a qualified health plan at that point, but they are not going to be allowed to get APTC because they may have been eligible for Medicaid at that point. The only reason they were denied is because of that non-responsiveness. So they can come pay the full fare. And you and I both know that most people who would have otherwise been eligible for Medicaid are not going to come back in and pay full fare for a qualified health plan at that point. So their best bet, and I think Mr. Fisher will also